July 9, 1893. A man lies dying on an operating table in Chicago, a knife wound to the chest, the blade pierced dangerously close to his heart. Every doctor in America would tell you the same thing. There's nothing to be done. Chest surgery is impossible. He will die. But the surgeon standing over him doesn't accept impossible. His name is Dr. Daniel Hale Williams, and what he's about to do will change medical history forever. Yet for decades, the world will try to forget his name. This is the story of a man who didn't just break barriers. He built entirely new institutions when America slammed every door in his face. Daniel Hale Williams was born in 1856 in Pennsylvania, just before the Civil War. His childhood was marked by abandonment. His father died when Daniel was young. His mother, unable to cope, scattered her children among relatives and strangers. Daniel found himself alone, working with his hands to survive, first as a shoemaker, then as a barber. His future looked nothing like medicine. But a white physician named Dr. Henry Palmer saw something in this young black man, brilliance that couldn't be ignored. Palmer took Williams under his wing, mentored him, and helped him enter Chicago Medical College. In 1883, Daniel Hale Williams graduated as a physician. He was one of only 3 black medical students in the entire country. A medical degree should have opened doors. Instead, Williams faced walls everywhere he turned. Black physicians couldn't practice in white hospitals, period. Black patients were routinely denied care or received substandard treatment in segregated wards, and black women who dreamed of becoming nurses had nowhere to train. The system wasn't just unfair, it was designed to exclude. So Dr. Williams made a decision that would define his legacy. If they won't let us in, we'll build our own. In 1891, he founded Provident Hospital in Chicago, the first black-owned and operated hospital in America. But here's what made it revolutionary. Provident served patients of all races. It trained black nurses when no other institution would. It proved that black medical professionals were just as skilled, just as capable, just as excellent as their white counterparts. Provident Hospital was more than a building. It was a statement, a refusal to accept the limits imposed by racism. Then came that summer day in 1893. James Cornish, a young black man, arrived at Provident Hospital with a stab wound. The knife had penetrated his chest near the heart. He was bleeding internally. His pericardium, the protective sac around the heart, was damaged. In any white hospital, Cornish would have been turned away or left to die. Even if they'd admitted him, they would have called his case hopeless. Dr. Hale Williams looked at James Cornish and saw a life worth saving. He decided to operate. Think about what that meant in 1893. No x-rays to see inside the body, no blood transfusions to replace what was lost, no antibiotics to fight infection, no modern anesthesia. The chest cavity was considered untouchable territory. Opening it meant almost certain death. Dr. Williams opened James Cornish's chest anyway. With a small team of colleagues watching, he carefully cut through skin, muscle, and bone. He exposed the beating heart. He found the tear in the pericardium and repaired it with sutures, his hands steady despite the stakes. Then he closed the incision and waited. James Cornish didn't die on that table. He didn't die the next day. 51 days later, he walked out of Provident Hospital. He lived another 20 years. Healthy, whole, alive, because a black surgeon refused to accept the word impossible. This was the first successful open-heart surgery in recorded medical history, a breakthrough that should have made headlines around the world. But Dr. Williams was black. So his achievement was ignored by mainstream medical journals, minimized by historians, sometimes credited to white surgeons who came later. Dr. Williams continued his work. He became the only black charter member of the American College of Surgeons. He helped reorganize Freedman's Hospital in Washington, transforming it into a first-rate medical institution. He trained countless black physicians and nurses. He built what they denied him, again and again. When Dr. Daniel Hale Williams died in 1931, much of America had forgotten his name. His contributions were erased from textbooks, his hospital's importance downplayed, the first open-heart surgery credited elsewhere. But the truth survives. Dr. Williams didn't just perform a medical miracle. He created institutions that saved lives and trained generations of healers. He proved that excellence knows no color, that when they deny you a seat at the table, you build your own table, and you make sure everyone is welcome there. His legacy isn't just in the chest he opened, it's in every door he kicked down and every institution he built. That's the story they tried to erase. That's the hero we must remember.